Good afternoon, everyone. My name is Dr. Jodie Guest. I'm an infectious disease epidemiologist and professor and vice chair of the Department of Epidemiology at Rollins School of Public Health here at Emory University. I lead Emory's COVID-19 outbreak response team working in harder hit communities across the state of Georgia and to provide vaccinations and testing. I'm also the host for Emory's COVID-19 videos where we talk about important topics of the COVID-19 pandemic. Today, I'm very pleased to be joined by Dr. Lee Savio-Beers. Dr. Beers is the 2021 president of the American Academy of Pediatrics. She is also a professor of pediatrics and the medical director of Community Health and Advocacy at Children's National Hospital in Washington, D.C. Dr. Beers co-directs the Early Childhood Innovation Network, a collaboration of health and mental health providers, community-based advocates, parents, and early childhood education centers and groups. And to brag for a moment, she earned her medical degree from Emory University School of Medicine, after which she completed her pediatric residency at the Naval Medical Center in Portsmouth, Virginia. Prior to joining Children's National Hospital, she was a general pediatrician at the Naval Hospital in Guantanamo Bay, Cuba, and at the National Naval Medical Center in Bethesda, Maryland. Her clinical and research interests include the integration of mental health and pediatric primary care, and the impact of adversity and stress on child well-being, as well as advocacy education, much of which we will be discussing today. Good afternoon, Dr. Beers, and thank you so much for joining me.
Oh, good afternoon, and thank you so much for having me here today. It's really a pleasure.
We are thrilled to have you back at your alma mater, and I know that this is such a busy time for you, and the timing of us getting to talk to you could not be more perfect. We're going to have a broad conversation today about children and COVID-19, including the pediatric COVID-19 vaccines that we have been hearing so much about lately. But let's start first, kind of at the beginning, the general risk of COVID-19 for children. We know that fewer cases of COVID-19 have been reported in children under the age of 18 compared to adults. It's not always fair to compare our children to adults. And there have been more than 6 million children who've been diagnosed with COVID-19, though, across this pandemic, including 135,000 cases in just this past week. Additionally, since the beginning of August, pediatric cases of COVID-19 have been on the rise. Beginning August 14th, 12 to 17-year-olds have actually had the highest rate of COVID-19 of new infections in the United States. So Dr. Beers, starting there, what are the reasons we're seeing pediatric cases continue to rise, especially this past summer and fall?
Yeah, well, and thank you for that. And I think there's a couple of reasons. First is that actually, children and adolescents are a larger percentage now of our unvaccinated population in the United States. And so they're really the group who are the most vulnerable to being infected because they're the ones who don't have the protection of the vaccine. Well, for sure, our under 12-year-olds and then many of our 12 to 17-year-olds as well. I think a second reason is that with the Delta variant, that has been much more transmissible. And so it does spread much more quickly in places like, big group gatherings or schools or things like that when children and adolescents aren't using good and safe mitigation measures. So I think really a combination of those two things has led to a real increase in cases across the country, and particularly in places where immunization rates are lower.
Which is here in the South where I am. We do know that children can get sick from COVID-19, but there was a lot of conversation at the beginning of the pandemic that they did not, but they can. And additionally, they can also spread COVID-19. Some children also develop severe illness, particularly those with underlying medical conditions. We talk a lot about the underlying medical conditions that are of concern in adults. What are these in our children?
Yeah, so it is very similar in children, actually, in many ways. I mean, certainly children with disabilities and special healthcare needs that might impact sort of their lung function or their cardiac function, their heart function, are at higher risk. We certainly have seen that children with obesity are at higher risk for more severe outcomes of COVID-19. And so, and I think part of what we've been seeing, across our children's hospitals and other hospitals that are admitting children is that, between about a half and 2/3 of children who are admitted and have severe disease have some kind of underlying condition, but about a half to a third don't. And so I think that's another really important thing to remember is that certainly there are conditions where you are as children at higher risk for more severe complications of COVID-19, but actually, really previously healthy children are as well. And we want to keep all our children safe.
Absolutely, we do. As more children do become sick with COVID-19, more of them have developed a very rare, and I want to make sure we point out the word rare, but serious condition associated with COVID-19 called multisystem inflammatory syndrome in children. So far, there have been a little over 5,200 cases of this syndrome in children and 46 associated deaths in the United States. These numbers have increased across the pandemic, and they peaked in January of 2021, where we saw so many additional cases of COVID-19 across all ages, but they also increased again this fall. Can you tell us more about this syndrome?
Yeah, absolutely. And I think, you're right to point out that it is an uncommon syndrome, which is a good thing. But also, I actually say this a lot, a small percentage of a large number of children ends up being a large number of children, right? And so that's why when we think about the really increased spread of COVID across communities, the more children who are infected, the more who may experience this MIS-C. And what we see with that is it's a multi-system illness. And so kids can have cardiac problems, heart problems, very serious ones that sometimes land them in the intensive care unit, issues with their lungs or their digestive system, that neurologic symptoms, where kids really are struggling with their neurologic function. And so really, kind of a wide range of things that we can see. And I think one of the things to point out here is that it can be it often is pretty serious in kids and can last for some period of time, actually, and cause challenges for kids for some period of time.
One of the interesting things about this is that it can occur in children who both we know have COVID-19, so they've had a test, but also those who've not tested positive for COVID-19, largely because they haven't had a test. What should parents be watching for, especially if they're in a community that has high transmission of COVID-19?
It's a great question. And in fact, in many ways, it's the same answer that we would give to lots of things, right? So as a parent, if you notice that your child is, really just not feeling well, not able to participate in their usual activities, seems to tire really, really easily, looks sick to you as a parent. I'm a parent too. I know, when there's something off with your child. And
Right.
So if something seems really off, that I think is a really important reason to give your pediatrician a call to take a look, because it can actually be a little bit difficult to diagnose, particularly as you note. Sometimes young people don't, sometimes families don't even realize their child had COVID because it was a very mild or asymptomatic case. And so it didn't get, so no testing was performed. But then a couple of weeks down the line, they start developing these symptoms, and you're able to look backwards and see that in fact, this is MIS-C.
Let's turn for a moment to vaccinations, a very hot topic. The FDA is scheduled to consider Pfizer's application for emergency use authorization for children ages 5 to 11 next week. We're all very excited as we wait for this conversation. So what are your thoughts about the safety of a COVID-19 vaccine in children in this age group?
Yeah, absolutely. I mean, I think one of the most important things to point out is that, the review system that the FDA goes through, the safety and efficacy review that the FDA goes through, is incredibly cautious and rigorous and careful. And so, I feel very confident actually that anything that's authorized by the FDA is a safe and effective vaccine, because they really are very cautious. And as with all medications and all vaccines, there's an extra layer of caution added to anything that's going to be used in a pediatric population with children. And so, they're incredibly cautious with adults. And then there's even an extra layer of caution added with kids. And so, the vaccines that are authorized to date for adolescents ages 12 and up and adults are very safe and effective. And I have every confidence that if and when the FDA authorizes a vaccine for younger children, it will be safe and effective as well.
And with 28 million children in this age group of 5 to 11-year-olds, If the FDA does approve this vaccine, how important is this going to be to curb pediatric cases of COVID-19?
Yeah, I mean, I think, as we talked about earlier, most of the cases right now are in young people because they're the ones who are most vulnerable right now because they're most likely to be unvaccinated. And so the more members of our society, of our country who are vaccinated, the less people the virus has to spread to. So it is an important part of helping to get the pandemic under control and helping to protect those around us, helping to protect, perhaps adults who are vaccinated but are immunocompromised, or young babies who still don't have access to the vaccine. But I think I would also add, and as a parent, this is always important to know and remember, is that it's also really important protection for your child. So it really has both, the vaccinating your child with a safe and effective vaccine has benefits for the community, but it also has really, really important benefits for your child.
I think it's very important, especially as we talk about children, to talk about, their risk is not nothing. And so this vaccine is very much for them as well as everyone they're around. There is knowledge already that the request for the EUA is for a dosage that is different for those who are 12 and older. And we want to make sure that we don't confuse dosage difference with a vaccine that's different. So can you talk to us about why this dosage is different and confirm that this is the same vaccine?
Yeah, no, it's a super important question. And it is the same vaccine. It is definitely the same vaccine. And this is, again, a very typical part of vaccine development where, when you look at a vaccine and you want to look and make sure that it's safe, and you want to make sure that it's effective, and you want to make sure you're using the lowest possible dose of the vaccine to be most effective. And so it's very typical, actually, to determine what that dose is in adults, and then work backwards a little bit with kids, because kids' immune systems are a bit different, and they respond a bit differently. It's actually, when we think about dose in vaccines, it's related to the maturity of the immune system as opposed to weight, which is another question that parents ask a lot. Like, my 11-year-old is bigger than my 13-year-old, so why is there a different dose? But it's really about the age and maturity of the immune system. And so what they have determined, actually, through these most recent set of trials, is that the dose for children ages 5 to 11 is a third of the dose for adults. And so what that means is that and to make sure it's the vaccine's administered safely and everything is very clear, the vaccine is going to be packaged in a different vial that looks a little bit different. So it's going to be easy to determine which one is the vial, which is the vaccine for the adult dose, which is the vaccine for the pediatric dose. And so there will be these pediatric vials for the vaccine, but it is the exact same vaccine, just a slightly less dose.
Very important. Thank you. And also very good that it's going to be color coded in a different type of vial. Let's move to President Biden's plan to distribute these vaccines for children under the age of 12 if it's approved by the FDA. This plan was announced on October 20th. And so what role are pediatricians and our schools going to play in the distribution of the vaccines?
Yeah, actually a really important role. And I think this is something that parents are glad about and that pediatricians are glad about. I think when we've, we have, or other people have done surveys of parents to ask them, where would you like to get the vaccine when it becomes available? Most of them actually, especially as children get younger, would prefer to get the vaccine in their pediatrician's office. And I think that makes sense, right? Because it means that there's someone who they can ask their questions to. They can, they know it's a place that's used to giving shots. It's used to giving vaccines to younger kids. And so they know how that all works. So I think parents, really, really feel comfort in being able to get the vaccine at their pediatrician's offices. And I think also clinics at schools are another important place, right? Because again, it's a place where, your kids feel comfortable, you know that they've developed good partnerships to be able to offer that to you. So I think it is important. I think another thing to know though, I think that other pieces of the survey is that we've seen is that about a third of parents of children in this age group are going to want to get the vaccine, as soon as possible, the day it comes out.
Right.
And so I think it is going to be important for parents to remember, particularly if you are one of those parents who's super eager to get it right away, which I was for my 12-year-old. When can we get an appointment as soon as possible? that, it may take a couple days after the vaccine is recommended to be able to get these new vials out to all the places that are going to be distributing it. And also knowing that your pediatrician's office is working as absolutely hard as they can to make the vaccine available to you, but they're also, testing kids for COVID and seeing lots of sick kids. So just a reminder to parents to, show a little grace, know that we're all working as hard as we can to be able to make the vaccine available to parents of young children, anywhere and everywhere we can that is easy for families to access, so that we can just make things easier for them.
That's so important to remember. And I was one of those parents that the day 17-year-olds were allowed to be vaccinated, I was first in line with my daughter. So, but that's an adult vaccination. And so that was already up and running and something easier for us to get. Across this pandemic, we do know that childhood vaccinations beyond COVID-19, our traditional vaccinations, have actually declined. And a lot of that's been about lack of access to pediatrician's office, schools not being in session, and so those requirements perhaps not being there. How important is it for us to catch up, and do schools play a role in this?
Yeah, it's super important. And it is actually one of the things we've seen over the course of the pandemic is that our rates of, what we call routine childhood immunizations, which basically means the ones that you've known, the ones that we've been getting all along, that has decreased pretty significantly for all the reasons that you point out. And so it's incredibly important, just because COVID is here doesn't mean other things have gone away, right? And so it's really important to make sure that kids are up to date on their regular shots, as well as it's also the time of year to get your flu shot. So you want to get your flu shot as well. And so that's another actually good reason why we're really, we're really glad that the COVID vaccine is going to be made available to pediatricians' offices, so that, again, to make it easier for families so that they can come and they can get caught up on everything and do it all sort of in the same place at the same time. So again, just, I agree with you, just a real encouragement for families to reach out to their pediatrician's office if they are due for checkup, or even if they're not sure, to just check in and see, are there any other shots that I'm due for?
It's important. This could be a lot of fun Band-Aids that your kids are going to leave the pediatrician's office with. The Pfizer and Moderna vaccines have been tied to an increased risk of myocarditis, and inflammation of the heart muscle, and pericarditis, and inflammation of the lining around the heart. This has been particularly in our younger men that we've seen this. And in August, the FDA did publish results from an analysis of Pfizer data estimating that this risk for these conditions in 16 to 17-year-old vaccinated boys could be as high as 1 in 5,000. How big of a concern is this, and balance that risk and that benefit of the vaccination for us?
Yeah, absolutely. And I think, again, I mentioned that as soon as the vaccine was available for a 12-year-old, I have a 12-year-old boy. So, right. this was, I looked at the data both as a pediatrician, but also as a mother who was going to make that decision for her own child. And I felt 100% comfortable getting the vaccine for my son. And there's a couple of reasons for that. I think, any medication, any vaccine has a potential side effect. And the fact that we've even identified, this is a rare enough side effect, that the fact that we've even identified it tells us that our vaccine monitoring systems are working really, really well. Because the fact that we even picked up that this was going on is a sign that our vaccine systems or monitoring systems are working well. And so the two things that really, I think that were important to me and that I share with families, first is that actually the risk of myocarditis or pericarditis, if you get infected with COVID, is significantly higher than the risk of myocarditis or with, potentially following a vaccine, significantly higher. And the other thing that we've been seeing is that, the cases of myocarditis after a vaccine, well, I mean, we always take this very seriously, right? But they have been mild cases. And in the vast majority of circumstances, while we never want a family to go through anything, right? The vast majority of circumstances, the kids who were impacted in this way got better very, very quickly. And there was a recent study just published that followed these kids for a long time, and they have made full recoveries. In contrast, children who get myocarditis from COVID-19 infection, so who get infected with the virus and then develop myocarditis, it's much more likely that they'll develop myocarditis. And the cases that they develop tend to be much more severe. There's still a range, but you see a lot more kids who are in the intensive care unit who are very seriously ill. And when we talk to our pediatric cardiologists, those are the kids that they really worry about. Those are the kids that they lose sleep over, because they really are quite sick. And I think the other thing, and we've been talking about this all along, that weighs on me is that in addition to the potential heart complications of getting infected with COVID-19, it's not a benign disease in kids. Right. Thankfully, most kids do well, but most kids do well with everything, right? So when you compare that to other things that kids might experience, it is a significant illness, and kids can get very sick. And I think, anytime we can prevent serious illness with a safe and effective intervention, it just makes sense.
It does indeed. I want to touch briefly on something that has made some news. A private school in Miami is saying that children who've been vaccinated cannot come to school for 30 days because they might shed the vaccine to other children. So clearly asking, can vaccines shed?
No, they don't. And in fact, this is one of the things about the vaccine, actually, the way it's designed, and most vaccines are this way, it actually completely disappears from your system within a couple of days. It travels in, it has a little messenger, and it tells your immune system to make its own antibodies, and then the vaccine just disappears. So it goes away. So no shedding.
Thank you. Let's stick with schools, though, for a moment. Children have not been the face of this pandemic, but they are certainly at risk for being some of the biggest victims of what this pandemic has done to our lifestyle. And their lives have been impacted in very, very profound ways. Some of this from socioeconomic status changes, but also the impacts of not being in school and being in school online for a year, losing family members, et cetera. So how important is it to keep our children in school, especially now that we have vaccines to protect them? And we know masks are an important part of this protection system as well.
Yeah, absolutely. I mean, I think it really is essential. I think this is something that we universally agree on. I think across the country is that in-person school has been really important for kids. And I think a couple of things, at the American Academy of Pediatrics, this has been our stance actually from the very beginning of the pandemic, from our first guidance about safe schools, which we released, the summer of 2020, that we should be doing everything we can to prioritize in-person learning for children. And the way we do that is to make the school environment as safe as possible. And so to your point, that absolutely means, at least at this point in the pandemic, wearing masks universally in the school, because that helps decrease the spread, particularly when we have little ones who aren't yet eligible. Ventilation, making sure that you're keeping space where you can. It's not always feasible in a big, in a school building, but where you can, keeping that space. I think it also is, now that actually most schools really are back for in-person learning. And one of the things that we've been seeing, particularly early on in the school year, was a lot of disruption in that in-person learning, because lots of kids were getting exposed or infected and needing to go home to quarantine. And so, vaccinations and masks can dramatically decrease the need for the disruption in-person learning from that perspective as well. And of course, it's just each and every one of us is better protected with the vaccines, dramatically better protected with the vaccine. So that's also just, of course, a really important part of safe return to school.
I know you co-authored a declaration from the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and Children's Hospitals Association to declare a national state of emergency. This statement discussed the soaring rates of mental health challenges among our children and adolescents and their families over the course of the COVID-19 pandemic, particularly being exacerbated by the fact that we also are discussing and seeing so much racial injustice and structural issues with racism in this country. Can you elaborate on the impact of COVID-19 on the pediatric mental health crisis that we have in the United States?
Yeah, absolutely. I mean, and I think this is something that I personally have been working on for many, many years in Washington, D.C., but also the American Academy of Pediatrics has been concerned about, and the other groups who joined us in this, the American Academy of Child and Adolescent Psychiatry and the Children's Hospital Association, really for many, many years. And we've been doing a lot of work in this area because, even prior to the pandemic, mental health was a serious concern. It was even prior to the pandemic, suicide was the second leading cause of death in children. But during the course of the pandemic, we've really seen this dramatically worsen. And I think, there are many reasons for that. Of course, disruption to schooling is part of that, which is why we recommended, kids go back to in-person learning, but also other things too. Many children have lost caregivers to COVID-19. They've experienced, stress from the economic instabilities in their communities. So lots of different things, as you point out, children of color are disproportionately impacted by all of these things, actually, in many, many ways. When we look at the number of children who've lost caregivers to COVID, a much greater percentage of those kids are children of color. And so I think it's has impacted kids in so many different ways. I think one of the things I like to emphasize, though, is that, it has been a really tough time, and it has been a really tough time for kids, but it is not too late for us to really come together and do the things we need to do to help children, help them thrive, get them the services that they need to thrive. And that's why that's really why we've been sounding the alarm for a while, but we really extra sounded the alarm this time. So.
Yes, absolutely. It's a very strong statement. And 140,000 children are estimated to have lost a primary or secondary caregiver to COVID-19. That is some serious stress, emotional stress that these kids have suffered. You did bring up suicide already, but I want to point out some additional statistics about that. The pandemic definitely came at a time when we were already seeing increasing rates of suicide in our youth. Suicide death rates had been steadily increasing from 2010 to 2020. And as you pointed out, became the second leading cause of death in our youth in 2018. Mm-hmm. So across the country, the data show dramatic increases in emergency department visits with mental health emergencies, including suicide attempts. So what role has this pandemic played in increasing these rates? And most importantly, what do we need to be doing to help? How do we help these kids?
Right. Yeah, no, I mean, I think, I think adults feel this too, right?
Right.
It's the stress and the isolation, and it's really been going on such a long time. And as an adolescent, your brain is still growing and developing, and it's always sometimes a little hard to see, think about the next day or the next week or the next month. And adolescents can be more impulsive. And so that does put them at higher risk for suicidal ideation. And so I think that, all of those things really do play together, in addition to the fact that actually it's been harder to access services during the pandemic. There are more kids who are in need, and the services have been a little harder to access because of some of the changes that have happened across the pandemic. And so those two things combined really have made this a really acute situation. I would say going forward, there's lots of things we can do, lots of things that we know make a big difference. One is making sure that we have enough mental health providers in places where kids are. So schools, pediatricians, offices, community centers, all those places, as much as we can get access to mental health services there, the better. Also making sure that for those kids who really are struggling a bit more significantly and who need intensive mental health treatment or inpatient treatment, that we have the beds available for them. I mean, we've been hearing about kids who wait in emergency rooms for, a week waiting for a bed for mental health concerns. And so we just can't have that. And so we have to really, we have to invest in the people and the workforce and the space that's needed to make sure that we have these services available. And I think the final thing I would add is just, actually there's something all of us can do, even if we're not mental health professionals, because kids thrive when they're in communities where they have safe, loving adult relationships. And so there's, we all interact with youth in lots of different ways. And so thinking about how we can help make our communities a stronger and safer place for our young people will make a difference as well.
I love I love that. Thank you for pointing that out. Dr. Beers, I would like to end today going back to the possibility of having COVID-19 vaccines in our youth ages 5 to 11. How important are these vaccines going to be for protecting our children, both from COVID-19, but also from all the impacts that we've been discussing that they've been living with through this pandemic?
I mean, I think this is just an essential layer of protection for our young people. It can give them a peace of mind. It keeps them safe. It gives their parents peace of mind. And I think it really, I think we're so heartened that it does appear that we're very close, to being able to make a safe and effective vaccine available for our 5 to 11-year-old kids as well.
And if you could, please, what would you say to parents who might be concerned or hesitant about getting a vaccine for their children? What's your final word for them?
The first thing I would say is that you're a parent and it's your job to understand the health decisions for your child. And so that's normal to have questions and expected. And so if you do have questions, reach out to your pediatrician or to a trusted health provider to talk them through. There's lots and lots of misinformation out there, and your pediatrician or a health professional who you trust can help you sort through that and help you determine what's true and what's not, and they can answer your questions and address any concerns that you may have.
Dr. Beers, thank you so much for joining me today. On behalf of Emory, we're so proud you're an alumni. Thank you for all the really incredible work you're doing advocating for our children during this incredibly unusual set of times that we're living through.
Well, thank you so much, and thank you for highlighting the important needs of children. It's so important, and thank you.
Absolutely. Thank you so much for everyone for watching as well. Thank you, Dr. Beers.
Thank you.